I will introduce Tracy officially in just a sec, but I just want to share. We had done a talk last week, and if you haven't watched it, Lisa will post the replay below about how I've helped her husband with his Parkinson's disease. And we have worked together 5 months, and I just want you all to see this. I just want to say Tracy is my mentor. She's my teacher. She is where I learned functional medicine. None of this would have been possible without Tracy. She is absolutely brilliant. The school is the best education I've ever had in my life. It was truly transformative for me and for everyone that I work with. And I just wanted to show you, I don't know if Lisa has even seen this, but the actual video of her husband's before and after, I'm going to share with you all now. And I want you to see on the left, this was only 5 months ago. You can see his shaking there. And on the right was the video interview we did that you can have a copy of if you all want to watch it. Search it in this group, search my name, Jodi Franklin, in this group, and you can see the actual interview of how we did it, the labs we did. He's not 100% yet, but we are getting there. We are putting Parkinson's disease into remission. And I'm so thrilled to have Tracy here today. I'm going to show you a couple examples of chronic pain remission as well in my practice after, but I want Tracy to start because I know that's why you came here today. So I want to introduce Tracy Harrison, the founder and lead educator of the School of Applied Functional Medicine. The registration is going on right now. So just know that if you're thinking about it, now's the time to do it. And Tracy's going to talk today about the gut-brain pain interconnectedness and how you as an acupuncturist will have these key functional medicine insights in order to help people reverse that dynamic. So thank you so much, Tracy, for coming today.
Yes, I am. I'm super excited. And again, Lisa, I thank you so much for inviting me into your space here. And I just have to say, as an aside, I am a beloved user. Acupuncture is part of my trio of preventive healthcare and has been for quite some time. And acupuncture actually helped my husband through dealing with some significant pain several years ago and a real strong part of his eventual relief from a pretty traumatic injury. I'm a fan, and I just want to start off actually by thanking all of you who do this work. Because as you well know, the way we address pain typically here, at least in the US and in so much Western medicine, is about numbing what is at play, often with great side effect and consequence that can precipitate other disease dynamics. And while that may be a blessing for an acute issue, an immediate intervention, it's not viable as an ongoing remedy. And we see all the time through the functional lens where people have been taking ibuprofen for years or steroids for years, and they have developed secondary, tertiary, quaternary, additional disease dynamics because, of course, this anti inflammatory agent is not addressing the roots. And so I so appreciate the approach to really trying to modulate the actual underlying function of the body. But I also think, as I just want to add to what Jodi just said about acupuncturists may actually be the modality that perhaps already best sees the body and its overall functioning as holistic. And so when we talk about interconnectedness in functional medicine that goes across traditional physiological systems or those kind of surgical specialties, this is not rocket science for acupuncturists. You understand that, of course, the brain is not separate from what's happening in the liver, and the liver's not separate from what's happening in the big toe. And the big toe's not separate from what's happening in the pancreas or in the kidneys or in the eyes. Everything is interconnected. And it's really a wonderful, just natural synergy between this type of traditional holistic, truly holistic practice in terms of functional medicine. And what we've seen, and Jodi, you said it perfectly, right? The opportunity in bringing functional medicine into your practice just gives you a bigger toolbox to go deeper, to really get not as a very synergistic combination with what you already have an expertise in. And so I do think it's a really wonderful modality for that synergy. But if it's okay, Jodi, I'm just going to share my screen and jump right in. And then I welcome you and Lisa both. You know me well. Feel free to interrupt, jump in, ask questions. I really want to be of service today more than anything else.
Thank you so much.
Absolutely. And I have a number of slides I want to step through here, but I've got a whole bunch of them in reserve just in case so that we can go there if questions arise. And if you can just let me know when my screen pops up here.
We see your slide. It says welcome.
Great. Excellent. We talk a lot about this concept of interconnectedness in the realm of functional medicine, which is very much this notion of holism, but it also has to do with the particular connected causality of suffering and dysfunction in a unique individual. And I am a scientist by background, and I think this is one of the most fascinating things about functional medicine because it helps us to acknowledge, I think, a simple scientific truth that it would not ever make sense to try to understand what is at play in a leaf that maybe becomes disease. We would never try to assess that, much less treat it without looking at the health of the stem and the stalk and the trunk and the bark and the dirt and the roots and the microbes and the environment and all of the other circumstances that can be at play in a unique organism's life system. And in fact, a lot of sort of systems engineering type of concepts are some of the underpinnings of functional medicine. But in that same way, of course, everything is interconnected in a human being's life system. And as you all well know, this is not limited to just the physiological systems and organs and glands. This also goes to the systemics that innervate them, whether it is the nervous system or circulation or lymph or the nervous system. And then all of the softer interconnected function in the body, right? Or whether that has to do with things such as fascia or a lot of the energy centers that some traditional sciences and modalities are based on. I think functional medicine honors all of these and looks to simply integrate and expand on them. But when we're looking at a unique patient through the functional medicine lens, we want to consider all of these things and then even go beyond the body to look at the environment. What is a person's relationship, their career, their outlook, their mindset, their belief system? How do all of these come into play? Because, of course, the body is constantly responding to the environment in which we are asking it to live and hopefully try to thrive, but certainly to live in the moment. And this points to a truth that we talk about often, and I think paints the picture of both the challenge as well as the massive opportunity that we all face in supporting people in our modern world, which is that so often people who come to our practices, there's seldom, right? And I'm not talking for the moment about acute medicine or emergency medicine, this type of thing, but more when we're looking at chronic dynamics, whether chronic disease, chronic pain. Often what is at play is not so much that anything in the body is actually broken, but rather the body is working exactly as it is designed to. And individuals are finding themselves making lifestyle choices that lead them to be stressed or toxic or chronically inflamed, maybe having an ongoing simmering infectious dynamic that won't resolve, maybe malnourished, right? Too many calories and chemicals, but not nearly enough actual nutrition. And sleep, as we know, is something we tend to be proud if we don't need it. We tend to be unrested, or even if we're asleep, if we sleep a reasonable number of hours, most of our waking hours are really quite driven. And we spend a lot of time in a sympathetic nervous system mode. What, of course, most people, just the public in general, don't understand is that we're not designed to have these circumstances at play, to make choices that are actually creating this environment in our body, and then still have the life experience that we all want, right? People want to thrive and grow and feel great and lose weight at the drop of a hat and have no pain and eat anything they want and have perfect bowel moments and good libido and good fertility and be relaxed and spontaneous about sex and just be able to thrive in all ways. But the reality is that these life choices and this life experience do not go together. It would actually be unnatural. because those life choices that we are making are about setting up the body to try to survive, to fight, flight, hide, and freeze. And yet, what most people want to be having is more of a parasympathetic dominant life experience that is about resting and digesting and healing and making babies, right? And we don't realize that these don't go together. And this is a really powerful point of patient education, inspiration, and empowerment, because we can certainly help someone with a temporary intervention. But I think we're all aligned here in our goal being higher threshold of impact. We want to truly help people get well and stay well. And the reality is, in a lot of the cultures that we're practicing, the norms are a big part of the problem. People are eating what I call crap food. They are experiencing a lot of toxins, not even abnormal exposure, just normal exposure. And then they're surrounded by stress of all kinds. And we've unfortunately normalized all these things. And unless we teach people just how much these promote disease, they're not going to know. And this is why I believe, and have seen in thousands of cases at this point, that when people actually have an aha experience, okay, wow, that's why my knees hurt all the time, where we're actually teaching them why, using simple language and stories and analogies that they can understand, then they can become more galvanized to be a part of their own healing journey rather than perhaps looking so much for someone to fix them. And it's an essential part of helping people to take back, I think, take ownership of their health and be a good, savvy clinical partner in working with you. Because the reality is, we know most people are eating a lot of calories and chemicals, right? There's a lot of artificial colors, artificial sweeteners, artificial flavors, artificial preservatives, artificial texturizing agents, and a lot of marketing, by the way, right? A lot of colors, but not a lot of nutrients, not a lot of phytonutrients and micronutrients in particular, which our entire biochemistry runs on. We also are living with an awful lot of toxins, and it's not just what we inhale and what we swallow. A huge toxic burden comes from what we slather on our skin in the name of personal hygiene and beauty products, or even things, especially here in the wintertime, that are outgassing in our living environments that is a huge contributor to greater inflammation, more fatigue, malaise during the winter months because we're not necessarily airing out our homes. But toxic overload is real issue. Obviously, the body is designed to biotransform these chemicals and excrete them to a certain degree based on their genetics, their nutrient status, and the aggregate load. And a huge amount of disease is precipitated by toxic overload, including pain.
I just want to say how synergistic this is, because the talk we did last week was all about Lisa's husband, Peter, with his Parkinson's disease. And I showed the labs of the high levels of toxicity that he had in his system, environmental toxins, mycotoxins, heavy metals. So this is so synergistic with that. And that was just a huge driver of his disease. And it's something we're dealing with right now. So
Yeah,
thank
well
you.
said, Jody. Absolutely. And then when the gut barrier function fails and the gut and the brain's inflammation starts talking to each other, that leads to a lot of neurotoxicity. And Parkinson's is a perfect hallmark of that. Awesome. That's great. And then I'm showing you these pictures, not because I don't think you understand these things, but patients love pictures. This type of thing is wonderful fodder for a group program or a workshop where people can really learn some of the choices that they are making that are overtly precipitating their suffering. And I love this cartoon. I joked with the cartoonist actually about this is hilarious, but really sadly true. We've gotten to the point where we want to compete about everything, including relaxation, which is just maddeningly hilarious. But obviously, it is also sad and frustrating in terms of the degree to which it is leading to dysfunction. But when we think about stress, we have to cast a broader net. It's not just about mental stress or even emotional stress or social stress. We have to start thinking about toxic stress, inflammatory or infectious stress, micronutrient depletion stress, right? There are all sorts of different aspects of stress from the body's definition that can be, again, promoting the nervous system to be hypervigilant more often than not. And that is naturally going to precipitate pain as part of the body's priming function to make us hyper alert in a threatening environment. That is not evidence of dysfunction. It's evidence of the body working exactly as it was designed in its effort to try to save us from what it perceives is an environment in which we may struggle to survive. That it feels like heavy language, but it's a good reminder of just how primal our nervous systems are. And while we think about so many stressful aspects of life being normal, they still prime our nervous system, and in particular, our nervous system with our immune system to be hypervigilant and alert and very reactive. And so this sets us up for a lot of functional imbalances. And so we teach that there are certain functional balances that can go awry. And this is a list of the primary ones. And some individuals are suffering with one in particular. Other individuals are suffering with two, three, four, or more imbalances. And in terms of pain in particular, if an individual has sympathetic dominant nervous system activation, if they are dealing with toxic overload, if they're in a catabolic state, if they have excessive inflammation, especially unresolved inflammation, all of these will increase pain on purpose in order to get us to respond. Because from an evolutionary perspective, this has ensured survival. We struggle with the same thing in terms of inflammatory or oxidative pain sources when we are using the body too much and not allowing for that good antioxidants recovery and healing. And we'll talk a little bit about today, if we have time, also about this notion of neurotransmitter imbalance, because there are some specific skewing, if you will, of neurotransmitters that are known hallmarks of pain. One of them is an imbalance in glutamate and GABA, which are the primary stimulatory and inhibitory, respectively, neurotransmitters in the body. And we can end up with more of a glutamate dominant dynamic, which is promoting a more aggressive, hypervigilant neurotransmission. This is actually a major cause of poor sleep as well. No amount of melatonin is going to fix that, actually. And this is also where the gut comes in to play, because as we know, the gut is a sort of a wild and crazy world where it's a zoo of microbial activity in there. And as long as we have good barrier function in the gut and we contain the craziness of the gut in those cavities, then the body has evolved, of course, to understand we relax about what's happening in the gut because we know it's crazy, but then we're hypervigilant everywhere else in the body because what happens in the gut should stay in the gut, right? Yes, but that's not how it works. And courtesy of all sorts of modern norms, whether it is using ibuprofen all the time for pain relief or even pain preventative, or using oral contraceptives, oral estrogen containing drugs, or perhaps consuming a lot of chemicals, especially artificial sweeteners in food, being deficient in certain nutrients like vitamin D or zinc. There are dozens of reasons why we can actually lose the integrity of the gut lining, and we get an enhanced permeability in the gut. And then what happens in the gut is not staying in the gut. And when the systemic body gets exposed to what leaves the gut, we get hypervigilance. We get more hypervigilant nervous system mode. And also the inflammatory mediators that come from the gut. 15 years ago, this was considered quackery. Now there's so much research to justify this, or to substantiate it rather. What happens in the gut doesn't stay in the gut, but often it goes and affects the blood-brain barrier. And so when we have a lot of gut origin inflammation, it can actually create greater permeability in the blood-brain barrier as well. And this is where we can end up with a neurotoxic type of dynamic, in particular that stimulates more NMDA receptors, which some of you may be aware of. That's the glutamate receptors, which is a huge mediator of pain. What happens in the gut doesn't stay in the gut. and it can affect the brain and it can directly trigger or a beginning or an exacerbation or a chronic nature of pain dynamics. And this is where there's a huge opportunity to add a huge amount of assessment capability and confidence and interventional customization to your practice in terms of being able to address multiple different avenues in a synergistic way. All right. So let me just give one example, right? So let's just talk about headache for a second. Very simple type of pain, incredibly common, right? And many of you likely know that there are multiple common behavioral contributors to that. These are things that probably make sense to all of us in terms of a neurovascular pain dynamic. But when we look at what are the functional imbalances that could be contributing to chronic, frequent, or maybe highly debilitating headaches for a unique individual, they are manyfold and they're going to vary by person. And so this is where, again, in terms of a traditional modality that honors and supports the need to understand what is at play in a unique individual and customize an intervention and change it as we move along in supporting them, functional medicine stands on that same principle, where one individual, for example, may be struggling with lots and lots of stress and a lot of elevated cortisol and high levels of adrenaline. But another individual may not have that at play at all. That may not actually be something that their particular presentation is struggling with. Maybe instead they have issues with adequate serotonin synthesis and transmission. This has also been well studied with regard to headache. Overall, serotonin plays a huge role in pain perception and also impulse control. And serotonin is primarily synthesized in the gut. Actually, 90+% of our serotonin is made in the enteric nervous system in the gut. And it requires certain nutrients. It can be depleted by certain medications. And when we have suboptimal levels of serotonin, we have increased pain perception. And can be tremendous empowerment to learn what are some of the most common contributors to that and look for them in the unique case presentation of an individual that you're supporting. And something I'm really passionate about, I think, in all of our practices these days is that COVID and long haul COVID is really starting to present some classic patterns. But again, it's bio-individual. Some people with long haul COVID primarily have trouble breathing, shortness of breath, maybe poor stamina. Other people may struggle with cognitive impairment, brain fog, aphasia, but still other individuals may just have gross fatigue and malaise and depression. And that's not a surprise at all. It's just because the cluster of disease dynamics that are presenting in their case of long haul COVID are different than someone else's. But specifically as it relates to serotonin, I want to describe something here in a little more detail. We have to synthesize any biochemical in the body we need, of course, right? And serotonin requires a variety of cofactors. And the amino acid backbone of serotonin is tryptophan. And tryptophan is an essential amino acid. You must consume it. The body cannot synthesize it. However, tryptophan is not primarily used in the body to make serotonin. That's not the primary usage. In fact, 10% or less of your tryptophan on average typically goes down that pathway. Instead, we use tryptophan down a different pathway, which helps we'll do a number of things. But for example, we use tryptophan to make niacin, vitamin B3. But in cases where there is infectious disease, and this is especially true of viruses, the body will commandeer tryptophan and send it down what's called the kynurenine pathway, which makes metabolites that support macrophages, makes metabolites that support immune function. And at any time, the body is prioritizing its use of nutrients to do what it perceives is the highest priority biochemical pathway in the moment. And so what we're seeing, and there's some really fascinating research on this, is that we can end up with so much tryptophan being shunted down the immune support pathway to help with COVID, and especially long extended COVID, that we end up depleting our tryptophan, and there's not necessarily enough left to make optimal levels of serotonin. So people may have mood imbalance, in particular anxiety. People may have enhanced pain perception. People may have poor impulse and gastrointestinal dysmotility, right? They may have gas or distension and bloating or constipation because serotonin is a key enabler of GI motility in the gut. And this is just one point of interconnectedness here. And obviously, in our limited time, what I'm really seeking to do is to give you some specific pearls, and I'll give you some references on a number of these slides, but to just paint the picture of what's possible in terms of being able to understand what is at play in a unique individual so that we can support them in addressing that. Can look for, does their diet have enough variety of essential amino acids? Do they have need for maybe a certain targeted supplement to address a gap that maybe is prevalent in foods they're not willing or able to eat? Or maybe they have some other interaction with a lifestyle choice that uses up a lot of a nutrient, right? For example, a lot of people these days taking antidepressants, SRIs and SNRI, they can lead to depleted levels of tryptophan or vitamin B6. And so we can end up with particular individual need for more of those nutrients.
I just
But
want to
it's a,
interject here for a
yeah,
sec,
go
Tracy.
for it.
I just want you all to think about how many patients you have that have headaches, perhaps because of this, because of what's going on with their serotonin levels. And also, 1 out of 4 Americans is on an antidepressant. You probably have so many patients you're working with right now that have anxiety, and I can't even count on all my fingers and toes how many clients I've been able to help with that dynamic completely reverse their anxiety without the need for medication because of figuring out this is one of the reasons for it. There are others as well. You'll be able to interpret labs to understand why they're anxious in the first place or why they have headaches in the first place. And you'll be able to figure all this out to undo it at the source and go upstream to figure out why this dynamic is at place for this individual. And imagine how many people you can help on a completely different level.
I want to,
It's also, yeah,
I want
Lisa, go for it. Sorry.
Yeah, thank you, Jody. Thank you, Tracy. I'm busy taking notes, by the way, but I wanted to include the fact that in Chinese medicine, we have many different patterns for headaches. So this is such a great example to see how the functional medicine approach overlays what we're doing with Chinese medicine and herbal medicine, because what we strive to do is also get at the root of the problem and prescribe herbal prescriptions to meet that individual's imbalances and that kind of stuff. And being able to see in lab work what is going on and then prioritize what to address first, second, third makes so much sense. And it just seems to be a really great tool to also use with a patient to be able to put in front of them what their lab work is and how it is changing over time.
Excellent. I agree 100%. That's fabulous. I am going to share my slides, Lisa, so we will be able to distribute these afterwards if you would like to, in terms of aiding everyone's notes. But I do want to just talk for a minute about, and you actually, this is a wonderful segue, what you've said, that ultimately being able to take all of that fascinating science and be able to customize an interventional plan, we have to look at the unique individual, and being able to feel capable and confident in doing this work and also help your patient to avoid being overwhelmed. We like to distill things down, again, using simple frameworks and analogies. Ultimately, functional medicine effectiveness hinges on being able to maximize, minimize, and prioritize for what a unique individual needs. Maximizing what they need in order to thrive, and that is going to vary by person. Minimizing what is harmful for that unique person. And then perhaps most importantly, prioritizing an environment for healing, which is the ultimate holism concept one of the most powerful concepts you can teach your patients is that all healing happens from a parasympathetic state, which is true. We do not heal in a sympathetic nervous system mode. And so often that is our cultural norm, and we struggle to create space to have an environment otherwise. But people struggle to do that because it's not normal. And this is why they need you, right? This is why they need a different environment to work with a partner in order to step by step learn from you and change their lives. But let's talk about the gut. But I just want to talk for a minute about IBS, right? So often we may think, oh, you were talking about headache. Now you're going to talk about IBS. I think a lot of conventional lenses would say, what could those possibly have in common? Pretty much everything. And you may be familiar with research that shows just how common gut dysfunction and various flavors and presentations of IBS can be at play in various pain dynamics, anything from headache to arthritis to fibromyalgia and more. And ultimately, there are imbalances that can occur in the gut, the effect of which, as I mentioned earlier, just don't stay in the gut. And a course, a wonderful, rich course that we call Disease Begins in the Gut at SAFM, is the first clinical course that our students go through because I think it's a truth of functional medicine that whether your expertise is fertility or pain management or metabolic disease or autoimmune disease, you have to master the gut because it's not reasonable to expect that disease presentation to resolve unless we address the roots of it that begin in the gut. And we do a deep dive into all of these, but I want to just show you a simple analogy. And this also demonstrates a bit what Jody mentioned earlier about going upstream. Oh, so often, of course, conventional modalities just focus on the downstream presentation, right? What are the symptoms? How do we treat it? But if we look upstream in the causal chain of interconnectedness, we know that the orange callouts here are some of the common presentations of irritable bowel syndrome. And of course, we can treat those with a variety of different things. But ultimately, just as Lisa well said, we want to go upstream and understand what is at play. And these in the gold frames here, you can see some of the most common gut functional imbalances that actually end up causing IBS. And certainly you can learn all about those and address them directly. But where the magic really starts to come into play is what's actually causing those in a unique person. Oh, one person can have poor gallbladder emptying and maybe secondary to fatty liver from type 2 diabetes. And that may be why they have maldigestion that's leaving a lot of poorly digested food available for microbes to ferment and give off a lot of byproducts that cause gas that show up as a symptom and a diagnosis. But for someone else, that may not be a problem at all. As I mentioned earlier, they may struggle with making adequate levels of serotonin. So they end up with impaired motility in the gut, which allows the buildup of metabolic byproducts, including gases that can influence transit time and promote diarrhea or constipation. That again, we can label, but unless we can go upstream and start to understand what is the real cluster of dynamics at play in a unique individual, it's hard to address it. And it can also be very frustrating as a practitioner to feel stymied by not being able to go further upstream. But of course, it's no surprise it goes even further than that because there are dynamics outside the gut that can be involved. And this is where in functional medicine, we're always asking not so much what is the diagnosis, but who is this person, right? Who is this person that has this particular presentation? And there are a lot of common functional imbalances and disease presentations in other systems. I don't think any of these surprise us. Nutrient insufficiency is often at play and exacerbating those because, again, people eat a lot of crap food. But then what about the underlying sociocultural norms or lifestyle changes that people make? And as you start to understand the science of how each and every one of these can be directly tied to a downstream dynamic, right? Even let's just pick a few, right? Excessive alcohol and inadequate B6 set up competitions for enzymes that make it hard to manage histamine, and an overload of histamine in the gut increases gut permeability, which increases the likelihood of immune hypervigilance to foods, which creates inflammation that presents as fatigue, higher levels of prostaglandins, which can create cramping and pain. And again, we'll label it, but we've got to be able to go upstream and look at what's actually at play. And as I mentioned a couple of times, part of the insidious nature of this and why you and your skill are so needed is because so many of these choices are just people being normal, people just trying to fit in, people doing what all of their friends are doing. And this is where we have an opportunity to help them to become educated, inspired, empowered with excitement and enthusiasm and awareness and options and tools, hopefully some community as well, in order to be able to make different choices. And so I'm just going to give you a little bit of information here. I'm not going to pause to talk about this because I have a lot else that I want to cover, but I'm really passionate at SAFM about making sure that we're staying on the edge because it's interesting. 15 years ago, when we started really diving into functional medicine and using it across many modalities and educating practitioners, an awful lot of the functional imbalances were not well understood. And there really wasn't that much research helping us to understand what's at play. Certainly good clinical evidence. There were a lot of pioneers making a difference, and certainly I'm grateful for, and we stand on all of their shoulders. And there are some underlying truths and common practices in functional medicine about the gut that we need to continue. But there are also a number of areas where we need to put more focus. And I think it's essential that we start to pay more attention to where these types of dynamics are at play in patient presentation. And I'll just speak briefly to a couple of these. I think one of them that's fascinating and amusing actually is so often we treat the mouth, dentistry, almost like it's a separate organism, right? Dentistry is not part of medicine. The mouth is separate from the rest of the body. But if disease begins in the gut, then we must remember the mouth is the top of the gut. And therefore, so often what is at play there is precipitating gut dysfunction and paying more attention to the health of the microbiome in the mouth, our immune function in the mouth, the various digestive enzyme engagement that actually begins in the mouth, toxins, the downstream impact of various dental interventions. I think it's a fascinating area of science that we're just now starting to understand. Even things like inhaled steroids, we think about that as being localized. But of course, you inhale something, it doesn't 100% go into the lungs. It's in the mouth, it's in the esophagus, it's suppressing immune function there and setting us up potentially for microbial imbalances there. So there's a whole host of aspects at play there. And again, the parasympathetic nervous system, which I want to emphasize because I know it's such a key underpinning of the balance and nervous system function, is such an underpinning of the goals of acupuncture and the importance of the vagus nerve. And you would have a hard time finding a really inspired article about vagal transmission's impact on the gut or immune function 10 years ago. But even just in the past 4 or 5 years alone, there's been a massive amount of research and publication and understanding how our behaviors that can either activate or suppress parasympathetic transmission have a dramatic impact downstream on things such as digestion and motility and immune hypervigilance. And so there's a whole host of areas that you can learn about and integrate into your practice. A couple of small little just pearls here. I could present so many of these. I just chose a few examples. And again, I'm very open to questions, but a wonderful example of interconnectedness here in terms of even physiology, the pancreas being such an important gland that we often, depending on our specialty, we tend to think about as either a digestive tissue or as an endocrine tissue. But of course, it's both. And if there's pancreatic dysfunction for one reason, there tends to be pancreatic dysfunction for other reasons. And given the widespread prevalence of type 2 diabetes and pancreatic dysfunction as a hallmark of that disease, research shows that those individuals are actually much more likely to have maldigestion as well, because the pancreas is not putting out optimal levels of insulin. It's not putting out optimal levels of digestive secretions either. And this is where an individual can have type 2 diabetes. And then over time, if we're not trying to reverse that, we're just treating it, then an individual can develop maldigestion and maybe downstream nutrient deficiencies as a result, or downstream microbial imbalances in the gut that can cause all sorts of different IBS or pain dynamics, as we've been talking about. This is just a sample slide from our metabolic course, but also from our gut course because of the interconnectedness there. And this is where we can start to understand where there's this crossover here. We can address it at its roots and then realistically expect an individual to begin to experience improvement in function in both areas. Stress. I don't think we could talk all day about the impact of stress on everything, but especially stress in the gut. If you're curious about this, is a wonderful paper that actually does a great job of explaining in a digestible format some of the physiological underpinnings of how stress affects digestion negatively, and how different mindfulness practices can have an overt impact on all of these items that impact digestion. But hopefully, you're seeing there a lot of overlap with what I've already been speaking of, right? What in terms of mindfulness improves stress also improves pain dynamics. And there's a strong point of interconnectedness here where the different simple lifestyle choices, whether it is breath work or different meditative practices, gratitude journaling, prayer, yoga, Tai Chi, all of these types of things have actually, believe it or not, been well studied in terms of not only improving parasympathetic activation, but also being able to normalize gut function. An area that I just wanted to share a few more thoughts on that I mentioned earlier that I think is really essential in terms of the gut brain pain axis. I'm going to switch over to talking more about the brain and the central nervous system in a moment, is about barrier function. The old adage of good fences make good neighbors, I think has some truth in the body, because we need barriers, right? Internal to various cavities, there are different microbes, there's are different nutrients, there's different immune function, it's a different pH, there's different motility, there's all sorts of different dynamics at play in different cavities. And we thrive when those are appropriately separate and have well regulated permeability. Obviously, a healthy gut is not a rigid, impermeable boundary because, of course, nutrients have to get in and waste products have to get out. But that is a ideally well-regulated barrier that the body will only purposefully make very permeable in acute disease states like sepsis, where we really want to throw open the gates to allow the huge concentration of immune function in the gut to help us address a systemic infection. But this can actually happen as a result of some fairly normal everyday choices. And again, this is where we can start to understand where some of these common contributors to excessive permeability can be at play in precipitating loss of barrier function, greater systemic inflammation, in part actually because of all of this craziness, the zoo I was talking about earlier, right? Because the level of diversity and population of microbes in the gut is actually planetary in scale. And when we're looking at just the crazy world that's happening there, the over 2/3 of our immune cells are there, and the immune system expects to find craziness there. But when we have various, for example, microbial byproducts or microbial debris that might be well tolerated in the gut, but once it gets overexposure to the immune system in the basement membrane of the gut lining or even systemically, the immune system can have a very aggressive reaction, generating different inflammatory mediators, right? Different cytokines. And in particular, interleukin 6 is a known top culprit in increasing blood brain barrier permeability. So, what happens in the gut doesn't stay in the gut, it goes into the systemic body. We get a huge surge of inflammation that can have a particular pattern that then goes and sets the blood brain barrier up for increased exposure to and increased risk of neurotoxicity and enhanced pain dynamics. Does that make sense, Lisa? Does that resonate with you?
Sorry, I was muted. Yeah, because I'm taking notes here. Yes, it does. And it just, again, it reframes everything that I do from a Chinese medicine perspective and gives a different way of helping me communicate to my own patients what's going on. Yeah, I'm already thinking of several patients that I can work through some of this stuff with and help them understand things in a little bit different way.
Excellent. That's great. That makes my day, right? In terms of, and this is the thing, actually, I think what you said is a great point. I'm a big believer in beginning to use what you learn right away because, at least at SAFM, all of our students are active practitioners, right? So you have practices, right? You have individuals that you're trying to help, and you can begin to implement what you're learning step by step and learning from that clinical experience. So I love hearing you say that. So often I think people wait. I want to know it all before I use it. And learning functional medicine, I think it's a lifelong pursuit, right? Because it's layers of information that we can build on over time. But I love hearing you talk about applying some of these right away. That's great. So let's talk a little bit about pain dynamics, right? So we've spoken about the gut, about several patterns of interconnectedness. But when we think about the gut. Again, what happens in the gut doesn't stay in the gut. And this is where an awful lot of the body's not only neurotransmitters, but neuropeptides are being synthesized or not in terms of being able to help with systemic function. And we, even in terms of the actual information flow, we know that the vagus nerve is, depending on the research you look at, between about 82 and 90% afferent. So it's largely the gut informing the brain and then the brain responding to the systemic body as a result. And as I mentioned on the prior page, we know that what is happening in the gut in terms of microbial imbalances or dysbiosis, and then endotoxin or microbial debris like lipopolysaccharide can dramatically boost gut generated inflammation that then sets people up for neurological challenges. And this is not just pain. Obviously, it can be all sorts of mood imbalances, obsessive compulsive disorder, anxiety, depression, all sorts of different imbalances. And then if it becomes neurotoxic, to the example that is near and dear to Jody and Lisa's heart, then it can become truly systemic as well by impairing the brain's ability to provide its aggregate oversight functions. A lot of research more in more recent years has helped us to understand this not only gut brain axis, but I think it's more accurate to talk about the gut microbiome brain axis. I joke all the time that it's actually the microbes that are in charge when you think about the impact they have on our physiology. So often I like to think about a mental exercise of who's the host actually. Are we hosting them or are they hosting us as a nice vehicle to get carried around in their thriving? I think you can make a good argument for either, actually. But as we're talking about here, we rely on microbial activity in order to regulate this gut brain axis. And we could really get geeky here in terms of learning about some of these things that the microbiome does or doesn't do that plays a role in neurological imbalances. And it's fascinating to learn that The short chain fatty acids, it's a waste product, if you will, of a lot of our bacteria, right? They basically chow down on fiber and other debris from our diet, and then they give us short chain fatty acids as a little metabolic thank you note for feeding them. And then these short chain fatty acids go and regulate our physiology, basically. We used to think that short chain fatty acids were just food for the colon. You need a lot of those to just grease the skids and keep things nice and happy with the colonocytes. But nay, nay, nay. We've learned quite a bit about short chain fatty acids and their role in influencing insulin regulation, affecting liver function, right? And affecting, again, blood brain barrier permeability, or how much of that we have. The microbiome plays such a regulatory role in our body. And a key part of their impact is their influence on direct modulation of what neuropeptides or neurotransmitters are made in the gut. And again, who's the host, right? In terms of the microbes being able to stimulate the enteric nervous system to synthesize certain patterns of these powerful communication molecules. That's a fascinating concept because then you start to see how your microbiome is influencing your emotions, your moods. So what does that say about the popularity of take a course of antibiotics just in case? We certainly see many different examples. Our practitioner forum, it's practically on a daily basis. We're seeing how a 2-week course of antibiotics turned into microbial imbalance, turned into gut permeability, turned into chronic osteoarthritis and highly debilitating pain, and all sorts of different chains of causality downstream. So there's all sorts of dynamics here that you can learn that I think are truly fascinating, right? The geek in me, the scientist in me, not only finds all of this very valuable, and it's such an amazing feeling when you can study it and really understand it and feel confident using it, but it's also just fascinating how rapidly the understanding of the body is progressing, and then how deeply fulfilling and satisfying to be able to use it to help people to achieve what not that long ago were unimaginable improvements in their health otherwise. And I want to give a shout out to you as well, Jody. You have just a great example. You're not alone in that, but I appreciate your willingness to talk about the incredible case examples that you have from your practice, because sometimes it shocks people that can be a norm in functional medicine, but it actually can. And it's not rocket science. There's nothing magic about it. It's just about getting at the roots.
It's
And
really incredible. Go ahead, Lisa.
I was just going to say, and the other piece that really fascinates me with this is the speed at which you can get shifts, like noticeable shifts in people that maybe have been dealing something for Jody, in your case, 20, 30 years. So I'm amazed at the speed at which you can get noticeable changes.
Yeah, Lisa is referring to the fact I had a chronic autoimmune disease for 20 years, and I'm now in full remission, just going through and making some changes and learning in the school. So that alone was worth the price of admission for me. But not only that, I feel better than I have than I did in my 20s, in my late 50s now. And I think better. I have more energy. I just feel so much better. It's been incredible. But go ahead, Tracy.
No, sorry. I was just going to say that is often a wonderful part of the experience of learning functional medicine, right? Is being able to turn our knowledge to ourselves and our families to be able to help them in ways that we didn't understand, or using tools that we didn't quite know how to use before. I'm grateful to have been a part of that journey for you. That's wonderful.
Yeah, really huge part of the journey. And I want to mention that those of you who feel like this is over your head right now, just know Tracy's going through a very rudimentary overview of this. If you're considering the school, there is so much repetition within the case studies we learn from and within the classes that you get. It's somebody like me who doesn't have the biochemistry background that you all have was able to grasp it. You're going to be fine. And just know that there's so many links you can see. This is a slide from a class. Tracy sifts through hundreds and hundreds of research papers before presenting it and gives you the best links and resources for each class. I know she mentioned that she's a scientist by background. Tracy actually has 3 degrees from MIT. I think she eats research papers for breakfast. And she really makes it easy for me. Instead of spending hours and hours trying to figure it out myself, I know the resources in the school are solid, and I can go down and look through the clinical treasure chest. We talked about this in the other session. So if those of you want to look at that, you can, but I can go through and find the information I'm looking for so I can help my clients and not spend hours and hours trying to figure it out myself. It's just amazing, the resources.
Yeah, that's awesome, Judy. I appreciate your saying that. But to be fair, while I may lead the organization, we have a wonderful team of 10 individuals on our clinical education team that all have different expertise areas and we work together. But to your point, trying to make access to important information more efficient, right? Because you can spend hundreds of hours doing research and not necessarily get what you want. I think being able to share vetted resources is really important because we really want to dive into the learning so that we don't just memorize protocols. We actually understand the dynamics because that's where confidence really comes from. Otherwise, we're just following protocols and we're not really 100% sure why they work and we don't feel confident customizing them. So I'm a big advocate of helping that deeper learning to be accessible and more efficient so that everyone can really get the confidence that I think that naturally conveys.
Yeah, I love that. And I also love that you teach us how to do this work too, not just the clinical education, but the there's a whole clinical skills intersemester that teaches you how to effectively apply it in your practice. And I will say, I'll show you an example from my practice a little later, but I was able to take what I was learning right away, to your point earlier, Tracy, start using this in your practice. And within my first semester at the school, I was able to quit my job and start doing this work full time. Just word of mouth, people were telling people about me and coming to me, and I had more and more people coming to me. And by the time I graduated, I had a full functional medicine practice. It was crazy. And not that this is necessarily every student's experience, but it's not uncommon at all. I have a lot of peers that are in the same situation that this made all the difference in the world to them. So I just want to point that out. If those of you are thinking about doing this kind of work, their acupuncturists are doing this already. It's setting them apart from other
Mhm.
acupuncturists. It's really giving you not just a competitive edge, but being able to help your patients on an entirely different level put their diseases into remission. It's phenomenal. Go ahead, Tracy. I don't want to hijack the
Yeah, thank you for
conversation,
your
but just so you
warm
all know.
words. No, I appreciate that. I appreciate that very much. Let's see. I could talk about some of these things all day. Let me just cruise along here. This Dr. Candace Pert coined the term psychoneuroimmunoendocrinology, which I think is not only a fantastic travel word, it is, I think, just a great representation of the legitimate interconnectedness that goes across these systems. And there are, as we've been talking about, so many emotional reactions and behaviors that affect our physiology. But then these physiological imbalances affect our emotions. And so there's this tremendous synergy that, again, is not just causing us to be in a good mood or be in a bad mood, it's affecting our pain perception, it's affecting our inflammatory balance, it's affecting our nutrient absorption, it's affecting our metabolic function, our glucose control, right? Our weight management, our thyroid function. All of this axis is particularly powerful because between human emotional and mental reaction to life and then our microbes, you've got most of the seat of control of human physiology. And the gut is a particularly powerful aspect to understand. Now, in terms of pain, I think all of you are well educated in basics of pain and this type of thing. And pain can have its roots in a variety of different things. But I like to teach and I ran a multimodality practice myself for a long time. And it's so powerful to teach the individuals you're serving that pain is generally not something that is a direct stimulus. It's something that your body inserts itself in, and it may be multiple systems, but it's basically something that ultimately your nervous system tells you, often very quickly, is a danger. And pain is part of the communication of the danger. And it's a powerful opportunity to think about our symptoms as being important words in the body communicating to us, rather than pain being an annoyance that we just want to numb, or just one of those things that happens that we want to pop a pill and forget, or try to head off at the pass. Ultimately, it takes energy, quite a bit of energy, for your body to communicate pain. And is trying to get a response in terms of continuously notifying us of a potential danger. And this is why pain on its own is a stress response, right? It causes the pain transmission, pain perception, does oxidative stress to the body. It takes energy to do that. And it can be really valuable, blessed information rather than something that we seek
Oh no, she's frozen. I don't know if we're
body
gonna.
when we're
Oh,
making
there she comes.
progress on that
All
front.
right. You beeped out for about 20 seconds there, Tracy. If you want to
Oh,
repeat the
okay.
rest of this. We need to wrap up soon anyway, but go ahead.
Okay.
Yeah, but I don't want to miss a single word. So please
Oh,
Okay,
can
so
you hear
go
me now?
ahead. We can. Yep, go ahead.
Okay, great. Let me turn off my video.
This is fascinating.
Yeah, isn't it? It's the school is just I couldn't wait to listen to the next talk. Every single class was like, "Oh my gosh, oh my gosh, oh my gosh." It was like light bulb moment after light bulb moment. It was just incredible. Trace, you with us? Okay, good.
Yeah, I think I am. I think I
Yeah,
am.
we can hear you now.
So I'll wrap up here, especially because there might be some questions, right, that I want to be happy to answer. But I'm just going to include some other slides in terms of tools. This is a diagram that I think is really powerful for sharing with patients because it helps them to see in a really accessible way that when they're fighting, flighting, and hiding, the body runs differently. It prioritizes different muscle contractions, different glandular secretions, different neurotransmission, different hormone levels. And it does all of that on purpose because it believes it needs to prioritize survival. And as long as the body is prioritizing survival, it is not prioritizing healing. It's not prioritizing, for that matter, fertility or detoxification or digestion and absorption of nutrients. And this is where empowerment, I think, is so key. These are not concepts that people understand in terms of just how powerful, simple choices are. People can have way too many stress hormones, and that can promote pain and inflammation, but they can also have way too few stress hormones because we know that cortisol and glucocorticoids are actually anti-inflammatory in nature. And a lot of individuals with chronic pain diagnoses actually struggle with inadequate levels of stress hormones like cortisol. We talked before about how stress doesn't just present as emotional issues, but also various patterns of physical stress. And I wanted to just share a list here of some of the most common sources of chronic physical stress that are overlooked. Things like sleep apnea, I think, is way more common than we typically observe or even assess or look for. Overexercising, some real simple everyday things that can actually be at play in creating a chronic stress mediated disease presentation. Many of you, I'm sure, are quite familiar with just how much we can purposefully activate better parasympathetic transmission. There are a lot of things that contribute to that have been well researched. And this is where a lot of the traditional healing modalities, as we know, been questioned maybe here and there, but in practice of them, you've seen just how effective they can be in terms of reestablishing this functional balance. And maybe I'll just end here on this one concept because a functional imbalance that is common in pain dynamics, as I mentioned in the very beginning, is GABA glutamate imbalance, which can result from that loss of barrier function that I mentioned earlier. It can actually be as a result of hormone imbalance, right? Women who don't have enough progesterone, for example, are going to have lower levels of GABA. So they're going to be more prone to anxiety, which makes perimenopause typically more anxious phase of life. There can be issues with toxins, as I mentioned earlier, but there are nutrient interventions. And then certainly in your traditions, you have herbal remedies that are very well known to affect some of these pathways. And so a lot of the traditions of the modality, I think, have great synergy with this in terms of presenting a toolbox. So I'm just going to share some information and some research on some of these particular pathways and dynamics. And I also just want to give a little bit of, I won't go through this, but especially in this day and age, I really like to share just how much we've learned about the disease dynamics that are common with long haul COVID and some good curated references here for this. Because I think a long haul COVID is really where functional medicine has an amazing opportunity to shine because all the different manifestations of long haul COVID are not at all being addressed well in conventional medicine at all. They absolutely require a deeper investigation and customized intervention. And again, I think acupuncturists are optimally positioned to be able to bring on board a larger field of knowledge and awareness that will well integrate with what they would already consider doing for these types of chronic infectious, chronic fatigue, depleting types of disease dynamics.
I'm just going to add one thing here, and this is why we all need to go to the School of Applied Functional Medicine, because right now already Facebook has given me a warning and trying to screen some of the language we're using here. We'll see how far we get with this, but I just want to
Oh
know
my
that
goodness.
the information gets censored. So trying to get that information out is a challenge. And so thank you, thank you, Tracy, for trying to help
Yeah,
us
no, I
understand that.
appreciate that very much. It's been a battle for all of us, right? Over the
Yeah,
past few years in
absolutely.
particular. So I won't speak to it, but I did want to include just a few slides given the topic of the day in terms of some specific supplements, in terms of types of interventions for pain, and also some of the related kind of neurotoxic dynamics. And obviously, these are self explanatory and they're references for that as well. But I just want to say thank you. I'm so grateful for the opportunity to share and hopefully inspire individuals who are restless and seeking to expand their practice and to have a greater impact and more financial abundance, better clinical outcomes, being able to integrate more tools. All of that is something I really honor and have a passion for supporting. We've been delivering accredited advanced clinical education to practitioners for almost 12 years now, and it's a real pleasure and a privilege for that student body to be very truly global. Our students hail from 73, oh no, 75 different countries now and 20 different modalities. And as Jody mentioned, for me, this educational offering is for sure about scientific rigor. I think that has to be an underpinning of what we teach. But the thing that's missing from so much functional medicine education is that sort of devil in the detail, practical application nuance. So that, as Jody well said earlier, you don't just know the science, but you can feel capable and confident to go use it in your practice. And towards supporting that goal, we offer our students over 150 hours of real life complex case practice as part of the curriculum, which is certainly something unusual in the world of even functional medicine, because so much of it is more theoretical. But I created SAFM 12 years ago because I had just gotten certified in functional medicine from an esteemed organization, and there was so much missing from the theory to actually being able to use it. And then to Jody's comment, build the practice with a waiting list and really be successful in doing it. And so certainly if that resonates with anyone in your community, I would be delighted for them to join us at SAFM. But whether they do that or not, I just want to say thank you for promoting acupuncture. As I said in the beginning, I'm such a fan of this particular modality, and it has influenced my life and my family's life so positively. And so it's a real pleasure for me to speak to this just because I can relate to it so personally.
It's definitely a full circle moment for me because of how much Jody has helped my husband. So I'm happy to be able to share what you do and what you offer to the acupuncture community, not just from a practical practice perspective, but from a business perspective, because I think
Mm.
it's just hand in glove. It really fits what we do, and we try to get at the root of the problem and communicate to patients in a way that addresses body, mind, spirit. And I think the way you presented this it relates so well to what we do. I know, Jody, you have a few things to say, but before I know, Tracy, we've used so much of your time, but there is one comment that I would like you to address, Tracy, because I posted while you were talking, I posted your diagram of the upstream picture slide. I think is
Mhm.
fascinating. And there's a genuine comment here that I could respond to myself, but I'd just love to get your opinion. It's from Lorella Saxena. She's an acupuncturist in ABA. Excuse me. And so she's commenting on the diagram, the upstream diagram. And she says, I feel like this diagram omits systemic causes of disease and places a lot of blame on the individual patient. Yes, we all have some degree of responsibility over our health, but poverty, environmental racism, and late stage capitalism have profound impacts on health. And self care is simply not available to everyone. I could certainly respond to that, but I know Tracy, I know your heart, and I know what you're trying to do to help transform our medical system in general and the way we approach it. So I just loved for you to respond to that, if you don't mind.
Yeah, no, I don't mind at all. I appreciate your asking it because I do think it's an important, I'm not even going to say nuance, it's an important foundational concept of functional medicine in terms of, as I said in the beginning, who is this person and seeing the aggregate life system that they're in and meeting people where they are. And I want to appreciate, I'm sorry, I forget what you said her name was, but I want to appreciate
Right.
that question
Hmm.
because I'm really passionate about bringing functional medicine into underserved communities. It's one of the reasons why I think we need to bring functional medicine into primary care, into managed care in the US and in national healthcare systems around the world, because the traditions of functional medicine have made it, at least the evolution of the field over the past decades, have made it financially inaccessible to a lot of people, and we have to transcend that. I think if we're really going to meet our goals for healthcare transmission that doesn't exclude people from a financial consideration or even environmental consideration. And this is why I love having diverse global practitioner community. And they present so many interesting circumstances that are simply part of the environment that people are in. And we have to meet people where they are. And I appreciate the feedback for sure. I apologize if I come across as being judging or labeling of that or blaming, because so much of what people are wrestling with is simply the environment in which they were born, in which they were raised, in which they are trying to function, as I mentioned earlier, just being normal. And then there are all sorts of episodic circumstances that are absolutely causing physiological imbalance. I think we have to acknowledge that truth, right? But to your point, we don't have to blame for it and throw all of that back on the patient. But I do think we have to acknowledge the truth of what that can be precipitating in a unique person so that with objective eyes, we can address it. And to your point, there are places where the patient is not going to be able to change something about that or their environment. And that might be based on cultural circumstances. It might be based on financial considerations, accessibility, to dietary choices. For some people, it's also even just based on their medical history. It's like an individual who's had an organ transplant. They will be taking immunosuppressants for life. We don't blame them for that. We don't try to take that away, right? It's part of who they are. And we acknowledge that objectively as part of what's at play in their body. But your question speaks, I think, to the need to customize and understand what are the aspects of a person's life system that are continuous or permanent, or something for that matter that a person is not ready, willing, or able to change. And I think the wonderful thing about functional medicine is the impetus is to be creative in finding ways we can help, because many times I think we're not able to say, this is a lifestyle change that you could do differently, that you could pursue, right? This is a behavior you could do differently. Also, often when people are suffering and especially in pain, an awful lot of what we may objectively say they could do differently is not accessible to them because the pain is so debilitating. It is their reality. It is an overarching heavy presence in their life. And until they start to feel better step by step, even a lot of what we theoretically might help is not necessarily something they can touch in terms of focus. And so I appreciate your question because that must necessarily be part of what we consider and assess in a unique individual's circumstance. So I
I
appreciate
just
the
want to
question.
I want to chime in and say also that
Yeah.
within the school, we have case studies where somebody may not be able to afford follow on lab work. Using the lab work that we have, what do we do in this situation? What do we do if they can't afford a lot of supplements? What do we do? We work with cases like this. And also, there's a whole module on how to do this work in a managed care setting, which I love because typically with functional medicine schools, it's all about entrepreneurship, the model that I have, where you meet and you charge big fees and you do tons of labs. And that's just not necessary to get results for people. And to Tracy's point, meet the person where they're at. You can make some changes that can have a profound impact. And it may not even be every single change that you have to make, but you can still have a profound impact on people using functional medicine from any kind of socioeconomic group. So I think that's great. And if you don't mind me, I'll just going to show you like 3 quick examples of a pain reduction that I've done with my clients. So just to show you, this man had psoriatic arthritis so bad he could not tie his shoes. And that 5-month mark must be the magic number, Lisa, because that's what we've done with your husband so far. But 5 months later, he is off his prednisone, no longer gets flares of psoriatic arthritis. He has no more pain and his psoriasis is gone. I also worked with this woman who had such crazy debilitating migraines and fibromyalgia that she was in bed by noon every day on Vicodin. And this was a first semester client. So this is my first semester. I was a little bit nervous working with her. She had already been to a functional practitioner, and I was very nervous about working with her because I was thinking, I know the tools in the schools, I can use it. And I was honest with her and said, I'm just not sure, but I'm going to do everything I can to help you. Sure enough, I worked with her for a total of a year and everything's gone. She's off the Vicodin. She is a bundle of energy. She no longer has to lie in bed from noon on. She's up and about. Her fatigue is gone. Her urticaria, her chronic hives are gone. Her migraines are gone. Her GI issues are gone. Her insomnia is gone. She is in the process. She lost the weight of her daughter on the right. She lost 90 pounds working with me. Just amazing, beautiful testimonials she wrote for me. And just know, she said the joint pain was unbearable. That's all gone. And just know that this is how I built my business. I don't do advertising. It's just word of mouth. They just tell all their friends about me. One more example, this arthritis. This woman had terrible arthritis. Her husband had gout pain and also hypertension and type 2 diabetes. Within 6 months, it didn't take 5 this time, 6, they reversed everything and they feel fantastic and the pain is gone. In fact, Patty was so inspired. She's a nurse and she decided to attend SAFM. So she is now a student in the school. So anyway,
I didn't know that. That's great. Awesome.
just wanted to inspire you
Wonderful.
all and let you know what is possible doing this work. And you will learn how to implement it into your practice. There is so much support. It's a wonderful community. I hope we've inspired you to go this route and learn this. It is the best education you will ever have, and you will help your patients on an entirely different level, change their lives. And it's so rewarding. You will absolutely love it. So thank you so much, Lisa. And thank you so much, Tracy. This was awesome.
Yes, thank you, Jody. And thank you, Tracy, from the bottom of my heart for showing up for us and for doing what you do. I really sincerely appreciate you taking time to be here. I'm totally honored. I'm a little over the top, I know, but I just really appreciate what you do. I've had the opportunity to watch some of your presentations in video form, so it's great to have you here live in our group. So thank you so much. I wish you all a great day.
Take care. Thanks.
Yeah. Thank you, Lisa. Thank you for the opportunity.
Bye-bye.